discuss a topic about the difference between primary and permanent dentition. So this topic will be most important for the UG final year students. So let's get into the topic. So as we all know, the human dentition is called as heterodont because it has three different types of teeth which is seen in the primary dentition and four different types of teeth that is usually seen in the permanent dentition. If the teeth is called as homodont, if the size and shape of the tooth will be same in all the dentition. But in human beings, it is, as I have already mentioned, three types in primary dentition and four types in permanent dentition. So it is called as heterodont. And the human dentition is also called as diphodont because there are two sets of dentition, and the first dentition is called as primary dentition, which is usually replaced by the second set of dentition, which is called as permanent dentition. In primary dentition, there are totally 20 teeth, which is also called as milk teeth or baby teeth. This teeth usually erupts into the oral cavity at the 6 months of age until the 3 years of the age of a child. For permanent dentition, the 20 teeth will be erupting from 6 years till 13 years of age, and the remaining 4 teeth will be erupting into the oral cavity from 18 years to 23 years, which is called as wisdom teeth. So the dentition of the human being is divided into three dentition, which is called as primary dentition, mixed dentition and permanent dentition. For primary dentition, as we told, it is called as milk teeth and it will have 20 sets of teeth. In mixed dentition, usually this primary dentition will be replaced, one to two teeth will be replaced by the permanent dentition, which is usually divided into first transitional period, intertransitional period and second transitional period. And the third period is called as permanent dentition period, in which totally the entire primary dentition will be replaced by the permanent dentition. So first difference and the foremost difference that we usually appreciate between the primary and the permanent teeth, as we all see through our naked eye, is the color. So the color, as I have already mentioned, it is lighter in color in the primary dentition, which is mainly because the refractive index of primary enamel and the milk is also same, which is equal to 1. This is the first and the foremost difference between primary and permanent dentition. And the color of the permanent dentition will be darker in color when compared to the primary dentition, which is usually stated as yellowish white or grey or greyish white in color. So next major difference is size. As we all know, the size of the primary teeth will be little smaller when compared to the primary dentition, and the crowns, as we appreciate, mesiodistally it will be wider for the primary dentition and it is wider occlusogingivally for the permanent dentition, and the shape of the anterior teeth will be cup shaped in the primary teeth and it will be square shaped in the permanent dentition, as well as the deciduous molars, that is the posterior teeth, will be squat shaped in primary dentition and it is trapezoidal shaped in the permanent molars. So the clinical significance with respect to the size of the teeth. So it is mainly related to the first transitional period, in which the deciduous incisors will be replaced by the permanent one. The main clinical significance is the mesiodistal width of the primary teeth will be more when compared to the permanent teeth, and also the cervical incisor width will be more in the permanent dentition when compared to the primary dentition. The term incisor liability is the difference between the amount of space needed and amount of the space available. That is, the amount of space available is mainly equal to the mesiodistal width of the primary incisors that is usually present, which will be replaced by the permanent incisors. It is usually 7 mm in the maxillary arch and it is 5 mm in the mandibular arch. So these differences will be usually overcome by three factors, which is called as interdental spaces, intercanine width and incisor inclination. The interdental space is usually seen in the spaced dentition, where 1 to 2 mm of space will be seen between each and every tooth in the primary dentition, which can be easily correlating with the overlapping of this incisor liability due to the difference in amount between the primary and the permanent dentition. Next is the intercanine width. As the child grows, the intercanine area increases in width because of the development of the dental arch, which is also contributing to the difference between the amount of space available as well as the space needed. Next is the inclination of the incisor teeth. The incisor inclination is more in the permanent dentition when compared to the primary dentition, which will also help to elevate the difference which is usually seen between the primary and the permanent incisors. So next difference is between the shape. So when we appreciate the occlusal anatomy of the tooth, the occlusal anatomy of the primary teeth will have a narrow occlusal table. This is mainly because the convergence of the tooth on the buccal and the lingual aspect, when it is approaching towards the occlusal aspect, the inclination will be more, which will be leading to narrow occlusal table. But when we see in the permanent dentition, the occlusal table will be very broad because the occlusal convergence on both the buccal and the lingual aspect will be very minimal when compared to the primary dentition. Next is the occlusal plane. Occlusal plane will be relatively flat. This is mainly because of the less number of grooves and pits that is usually appreciated in the occlusal anatomy. And when we compare this with the permanent dentition, the occlusal plane will be more curved because there will be well defined and development of the developmental grooves, fissures as well as pits will be more defined in the permanent dentition when compared to primary. And when we talk about the cervical construction, that is usually appreciated in the primary dentition, which will be more prominent when we see towards the cervical area of the tooth, and this cervical construction will not be well marked or it is not usually visible in the permanent dentition. So next difference is between the incisors between the primary and the permanent will be, the primary incisors will not have mamelons. Mamelons are nothing but the arch-shaped projection that is usually seen in the tip of the tooth, which is corresponding to the number of the developmental lobes that is usually seen during the development of the tooth. So in primary dentition the mamelons will be absent, but in permanent dentition most of the incisors will have the mamelons at the incisal aspect. When we talk about the cervical ridges, as we told, the cervical construction will be more prominent in the primary teeth when compared to permanent. So the cervical ridge will be very much prominent in the buccal aspect of the primary dentition molars, especially in the primary mandibular first molar. And the cervical ridges in the permanent molars will be more or less flatter because the cervical construction is less prominent when compared to primary dentition. And when we talk about the major difference in the canine, the canine will be more or less conical shape in the primary dentition, and it's less conical when compared to primary teeth in the permanent dentition. And when we talk about the cusp tip in the canine teeth, it will be more prominent and sharp in the primary dentition, and it's less pointed when compared to the primary dentition in permanent teeth. So when we discuss about the anatomical difference between the molars between primary and permanent dentition, the occlusal plane will be relatively flat for the primary teeth, but it will be plain, curved and contoured for the permanent dentition. And the subliminal grooves will be more in the primary dentition when compared to the permanent dentition. In contact areas, when we see in the primary dentition, it will be broader and flatter contact area, which is corresponding to the occurrence of dental caries more frequently in the interproximal area. But the contact areas in the permanent dentition will be narrow, which will be leading to less caries occurrence in the interproximal area. And this contact area will be usually located in the gingival third of the tooth in the primary dentition, and it will be located in the occlusal third in the permanent dentition. So next difference is seen between the pulp of the primary and the permanent dentition. So when we appreciate the pulp chamber of the primary dentition, it is usually larger when it is smaller when compared to the size of the tooth in the permanent dentition. And the pulpal outline, which is usually more closely following the dentino-enamel junction, which is usually appreciated in the primary dentition, but the pulpal outline will not follow the DEJ, which is less likely or less closely related to the dentino-enamel junction seen in the permanent dentition. And the pulp horns will be more closer to the outer surface, which is usually appreciated in the primary dentition, and in permanent dentition the pulp horns will be comparatively away from the surface of the occlusal aspect. So the root canals that is usually seen in the primary dentition is ribbon-like shape, which will be thin, tortuous and have a branching path. This will be corresponding to the presence of accessory canals that is usually present in the middle and the apical third of the root in the primary dentition. But in permanent dentition, the root canal anatomy will be well defined with less branching, which will lead to absence of the accessory canals in the permanent dentition. And when we talk about the cellularity and vascularity, it is usually high in the primary dentition, and the degree of vascularity and cellularity will be less in the permanent dentition. And the high repair potential will be seen in the primary teeth because of high vascularity and cellularity. There will be more prone for repair, which will be usually appreciated in the primary dentition, but the cellularity and vascularity is less, which will lead to decrease in the potential of the particular tooth to repair capacity, which is corresponding to the less degree of repair in the permanent dentition. So the pulp will be less innervated because of the higher vascularity and cellularity. The density of innervations will be very less in the pulp of the primary teeth when compared to the permanent teeth, which is densely innervated because of the abundant nerve supply, which is usually corresponding to the A and A delta as well as C fibers that is usually seen in the pulp. And the nerve fibers will be terminating in the odontoblastic zone as a free nerve ending in the primary dentition. So the nerve fibers will be terminating among the odontoblast, and even they pass beyond the pre-dentin, which is usually seen in the permanent dentition. So the floor of the pulp chamber in the primary dentition will be more porous. This is mainly because of the presence of accessory canals and the tortuosity of the canals that is usually appreciated, and the permanent dentition will not have any accessory canals, so the floor of the pulp chamber will be less porous. Next, the accessory canals will be directly leading to the interradicular area that is usually appreciated in the primary molars. This is mainly because of the presence of many accessory canals that is in the furcal area, which will lead to increase in the chance of reinfection when we do a root canal treatment in the primary dentition. And when we compare this with the permanent dentition, the accessory canals will not be appreciated in the interradicular area. It will be mainly seen in the apical thread, but in very rare cases we can appreciate. So when we see the histological difference between the primary and the permanent dentition, the thickness of the enamel will be uniform in the primary dentition, which is usually 1 mm, which is seen all over the crown of the tooth. But in permanent dentition, the thickness of the enamel will be thicker when compared to the primary teeth, which is around 2 to 3 mm in the crown of the tooth. And when we talk about the enamel rods, that is usually directed in the cervical area occlusally from the dentino-enamel junction. But in permanent dentition, the enamel rods in the cervical area will be directed gingivally from the DEJ. So the main clinical significance when we look into this enamel rods during cavity preparation is we should remove the unsupported enamels during the class 2 preparation in the permanent dentition. So the incidence of reparative dentin formation in the primary dentition will be more, but in an irregular pattern. But when we see in the permanent dentition, the incidence of reparative dentin will be lesser in deposition, but the pattern will be very regular when compared to the primary dentition. Also, when we see about the dentin thickness between the primary and the permanent teeth, in primary teeth it will be half the amount seen in the permanent teeth, and the dentin forming cells will be remaining functionally for about 360 days in the primary dentition, and it is about 700 days in the permanent dentition. And when we appreciate the incremental lines of rexures, which will be more in the permanent dentition when compared to the primary, and the enamel will be less mineralized and it has more organic compound in the primary dentition. But when we see the permanent dentition, the mineral content will be highly mineralized in the permanent dentition. And with respect to interglobular dentin, which is usually absent in the primary dentition, but in the permanent dentition, the interglobular dentin will be well appreciated in the histology in a regular pattern. And the enamel and dentin will be more or less mineralized and less dense when we see in the histological aspect of the primary teeth when compared to the permanent teeth. With respect to neonatal lines, it will be usually appreciated in all the teeth, that is incisors, cuspids and molars in the primary dentition, but the neonatal lines will be seen only in the first permanent molar. Next, when we talk about the dentin thickness, as I have already mentioned, it will be half the thickness of the permanent dentition. And when we see the shape of the dentinal tubules that is usually seen in the histological section, it will be less regular in the primary dentition when compared to the permanent dentition, which will be more or less regular pattern will be appreciated with S-shaped tubules in the histological section will be seen. Next, when we speak about the difference between the roots will be more delicate because of the minimal amount of thickness that is usually seen in the dentin of the root. But when we see into the permanent dentition, the roots will be very stronger because of the amount of thickness that is more when compared to the primary dentition. And the roots will be more longer and slender when compared to the crown size in the primary dentition. But in permanent dentition, the roots will be shorter and bulkier in comparison with the crown of that particular teeth. And the size of the teeth will be narrower mesiodistally in the primary dentition, and it will be broader mesiodistally in the permanent dentition. And furcation. What is furcation? Furcation is the point where the root is dividing into two. This furcation is usually more cervically placed in the primary teeth when compared to the permanent teeth. So the root tongue is the space between the cervical enamel junction to the furcation point. So it is usually smaller in the primary dentition when compared to the permanent dentition. And when we see the roots that is usually seen in the primary teeth, the flaring is usually more when compared to the permanent dentition. This is mainly because to accommodate the tooth bud that is usually present beneath the roots of the primary teeth. And the primary roots undergo physiological resorption, which is not usually appreciated in the permanent dentition, but it may undergo any pathological type of resorption. Next is the major differences between the apical foramina of the primary dentition, which is less constricted because of the rich vascularity and cellularity, but it is apical portion is more constricted in the permanent dentition, which is corresponding to the lesser vascularity and cellularity in the permanent dentition. The size of the apical foramen will be wider in the primary dentition, which is narrower in the permanent dentition. And as I have already mentioned, the cellularity and vascularity will be more, which will be corresponding to the abundant blood supply, which is equally relating to the type of the inflammatory response that is usually given by the primary teeth. So, because of the reduced blood supply seen in the permanent dentition, the type of inflammatory response will be very delayed, and the healing will be seen following a scarring type of response, usually that is appreciated in the periapical radiograph. And there will be poor localization of infection and inflammation that is seen in the primary dentition, but the infection and the inflammation will be well localized and it's comparatively identified in the radiograph when compared to the primary dentition, which is usually seen in the permanent teeth. So, moving on to the difference between the cementum. The cementum will be very thin in the primary dentition and it's very thicker in the permanent dentition. There are usually two types of cementum that will be seen in the human dentition. One is primary cementum, next is the secondary cementum. Only primary cementum will be seen in the primary dentition, but in permanent dentition both primary and secondary cementum will be seen. So the clinical significance with respect to this primary cementum is, the primary cementum is mainly responsible for the anchorage of the tooth, but it's less firm when compared to the secondary cementum, due to which it is easily resorbed, which will be corresponding to the physiological resorption of the teeth that is usually seen in the primary dentition. So it can be easily extracted, which will pay a path to the erupting successor. So the next difference between this primary and permanent dentition periodontium is, as the periodontal fibers are less firmly attached, it will undergo easy resorption, which will be leading to easy extraction in certain pathology conditions like dental caries. And it is firmly anchored in the alveolar bone, and it's usually not easily resorbed in the permanent dentition when compared to the primary dentition. This abundant blood supply that is usually seen in the primary dentition will be leading to poor localization of infection and inflammation in the primary teeth when compared to the permanent teeth, which is usually well localized in the permanent dentition. That's all the difference between the primary and permanent dentition. I will see you soon with some other interesting topic. Thank you.